Hello, how are you doing today? Mrs. Tougas, sorry. My patient pointed out to me after in between our assessments that I am not Dr. Tougas. I am Nurse Tougas. So it's good to see you. This is Nurse Tougas, Mrs. Tougas. So you're doing well today? Okay, fantastic. I'm going to go ahead and today we're going to be doing an abdominal exam on you. Okay, so we're going to be checking, just making sure everything's going okay. I'm going to go ahead and wash my hands, okay? All right, so for this exam, we're going to have our patient lying flat on her back. The first thing that we're going to do is we're going to go ahead and look at some areas that don't really, the abdomen is actually the second thing we're going to look at after we look at some other areas. I'm going to check out her hands and her nails. The nails are in the hands can tell us a lot about patients. Different anomalies with the nails can mean different things as far as nutrition goes, things along those lines. So we're checking on the nails and the hands for any peripheral signs of hepatic or GI disease. We're going to go ahead and check out the eyes. We're looking for scleral jaundice in the eyes. So all looks well there, no jaundice. Good. Okay. Jaundice can indicate liver problems. So then we're going to go ahead and I'm going to have her, if you look my way, I'm going to look at Virchow's node, which is a lymph node over here that can indicate problems with GI or hepatic malignancies, intestinal malignancies, sorry. We're going to check in her mouth. We'll look for ulcers, dental caries, bleeding gums, signs that she could be having issues with GERD, gastro reflux disease. Dental caries could indicate problems with that, as the acid ends up causing problems. Bleeding gums can indicate issues with clotting disorders, liver problems, when it comes to formulating the different things for clotting mechanisms. Bruising just everywhere around the body, any kind of bruising can indicate bleeding problems as well. So we're gonna go ahead and check on the mouth, just look for those kinds of things. Okay, all is well. Okay, no ulcers, no dental issues, no bleeding gums. So we're gonna look, if you can go ahead and look that way, ma'am. Okay, so we're gonna look for jugular vein pulse. All looks well there. That can indicate backed up fluid overload issues, which would indicate problems with the liver, possibly. So we're going to next just take a look at the abdomen, and we're just going to look at it and look for peristalsis, any outward signs of surgeries that she might have had in the past, scars, discoloration. Some of our patients have obvious hernias that you can see just from looking. So anyway, so that's what we're looking at there. So we've got her lying flat on the bed. We're looking for those kinds of things. Okay, so next we're going to take a look at, we're going to do some auscultation, actually. We auscultate, and we do that before we do palpation, percussion, any of that stuff, because we don't want to affect the noises that we would otherwise hear by doing any kind of manipulation. So what we're going to do is we're going to go ahead and listen to the bowel sounds in the 4 quads. We should be hearing about 5 to 30 bowel sounds per minute in each quadrant. We're listening for that kind of tinkling sort of noise. We're going to take the bell of the stethoscope and we're going to listen over the spleen and liver areas for friction rubs. So the liver area and the right upper quad. Splenic area. Good. Now we're going to go ahead and listen for with the bell and the diaphragm for vascular sounds in the abdominal area. We're going to be listening to the abdominal aorta for pulsations. We're going to listen to the renal and iliac arteries and the femoral artery. We're listening for bruits and vascular sounds. So we're going to start at the abdominal aorta, just above the umbilicus. Good. And that'll go to the renal and iliac arteries. Good. And the femoral arteries. Again, listening for bruits. Okay, good. Nothing special to be heard there. All appears to be well. Now we're going to go ahead and do some percussion. We're gonna be locating the liver and the spleen, and we're gonna be percussing over all four of the quadrants. We're gonna listen for tympany, for air. Make sure there's no fluid or dull structures where there shouldn't be any. So our patient's laughing at us. Good. Okay. So so nothing out of the ordinary there. We're going to go ahead and locate our liver now, and we're going to go ahead and do this. When we're percussing over over the bone, over the ribs, we're going to hear a dull sound. It's going to be really dull. When we're percussing over the liver, it's going to be dull because it's a solid structure. Same with the spleen. When we're percussing over the bowels and other just air-filled areas, it's going to be, we're going to hear tympany. So when we're percussing up the ribs, while we're finding the liver, we're going to try to percuss in between the ribs, because percussing on the ribs wouldn't give us anything other than a really dull sound. So so we're going to go ahead and start doing that. So. And our patient's laughing at us some more. Apparently we're tickling her. Do you need a minute, ma'am?
Don't die. Tickle.
Okay. Okay, we good? Okay. All right, so. Okay. Then we're going to go ahead and mark with our skin pencil, not our regular pencil, but our skin pencil, of course, our areas. So. Okay. So there's the liver. Then we're going to go ahead and look for the spleen. It's a little bit harder to percuss sometimes because of air and stuff like that in different areas. That's going to be the 10th rib. There's 12 ribs, so if we go to the right side here and we count up a couple of ribs, then we should be good. Okay, so. Okay, so we have us a spleen. I'm going to go ahead and have you take a deep breath while I'm doing that. Do it again. We want to make sure that we don't have like any splenic enlargement. Same thing with the liver. Make sure there's no liver enlargement. That could, of course, not be good. So then we can go ahead and look for the bladder. Bladder is going to be in the pelvic area, going up towards the umbilicus. Bladder retention would obviously be a problem. It would be like a dull mass with all that fluid in there. So good. Okay. All right. So next, we're going to do palpation. So we are going to start with light palpation. We're going to do this to the nine anatomical regions of the abdomen. We're going to be looking at her facial expression while we're doing it, hoping that we don't initiate any painful response or anything like that. And hopefully she doesn't laugh throughout the whole thing. While we're palpating, the first thing that we're going to notice is like soft abdomen versus a rigid abdomen, which could indicate distension. The other thing this does, light palpation, it kind of gets her used to things, gets her relaxed, and gets just kind of the abdominal muscles relaxed before we move on to deep palpation, which can sometimes be more uncomfortable for the patient. So we're going to lightly palpate. Again, looking for any kind of masses. Good. Okay. So that's good. Light palpation. Now we're going to go ahead and begin deep palpation. We are going to start with the right upper quadrant and then move to the left upper quadrant, right lower quadrant, and left lower quadrant. So we're starting with right upper quadrant. We're looking at the liver. We're going to deeply palpate down and up toward the costal margins, and we're going to have her take deep breaths, and we should be able to palpate the liver. Then we're going to look for Murphy's sign, which is cessation of inspiration, like due to pain, while I'm doing deep palpation for the liver. That could indicate gallbladder inflammation, gallbladder problems. So anyway, so we're gonna go ahead and get started with that. So we'll deeply palpate down and toward the costal margins. So okay, deep breath out. Good. There, we're kind of pushing up towards the ribs there. So, and we can feel the liver there, right there. Okay, good. So that's good. So the next thing we're going to do is we're going to look for kidney enlargement by reaching around, and then we can palpate down, and we should be able to feel. This can be uncomfortable, so. Good. There's the kidney right there. Good. Okay. We're going to go ahead and feel for the abdominal aortic pulse. If we get any really bounding noises out of auscultating at the abdominal aorta, any bruits, anything along those lines, then we would not want to do this, because the last thing we want is for her to have an abdominal aortic aneurysm and us cause any damage to that that's not already done. So we're going to go ahead and palpate for the abdominal aortic pulse. Now we're going to palpate the left upper quadrant for the spleen, and we should not be able to feel the spleen. If we can feel the spleen with deep palpation, then that probably indicates splenic enlargement, and then we would want to refer her to the proper individuals to check out that further. So go ahead and breathe deep and out. Good. Again. Good. Okay. All right. So now what we're going to do is we're going to look for we're going to look at the right lower quadrant, and most of the work that we're doing in the right lower quadrant is geared towards the appendix. We're looking for appendicitis more than anything. That's really the main thing that we're going to find in the right lower quadrant is the appendix, which is right down here. This is particularly important in younger folks who oftentimes come into the ER for appendicitis. So McBurney's point is 2/3 of the way between the umbilicus and the anterior superior iliac spine, which is right here. So McBurney's point is going to be right about here. And this is really kind of the magic button spot for some of our tests, the different maneuvers that we would do. If she's experiencing pain at this spot when we do certain things, then that could indicate appendicitis. So what we're going to do is we're going to have her put her leg up. Good. Okay. Good. All right. I'm going to go ahead and assess for rebound tenderness here. So I'm going to push in and push out and try to find out where it hurts more, in or out. So any significant pain or anything like that when I let go? No. Okay, same thing over here. Any rebound tenderness at McBurney's point indicates problems, and we would want to have that checked out. So we're going to go ahead and again, when we put the leg up like this, and she pushes kind of against it a little bit. Okay. Any pain right here? No? Good. Okay. Good. Any pain right there? Okay. Very good. So that's good. We can also no pain right there. Good. Good. If we're having pain in the left lower quadrant area, then a lot of times what we could be looking at is peritonitis. So, by the way, one thing that we're going to want to find out, last bowel movement, when was it? Yesterday, okay. Any constipation, diarrhea, anything along those lines? No. No stomach upset, no pain, ordinarily, no pain when I'm doing any of these maneuvers on you, correct?
No.
Okay, great. Okay, so next thing we're going to do is we're going to look. Now, she obviously doesn't have any liver ascites, just looking at her. But if she did, then we could do some maneuvers to check on the liver ascites. So she should have dullness to her flank areas. Ordinarily there would be fluid on the flanks, and if she had ascites, and it would be air up top because the fluid drifts is dependent. So there would be dullness there, and we would have tympany up here on top. We can have her roll to her side. And if there were any issues with ascites that we're concerned about, then we would have our fluid would go from the side area from the flanks into the belly area, particularly the bottom part of the belly area. And we would then have tympany on top because the fluid wouldn't be up here. And we would have dullness on the bottom. The last thing we can do is we can do the, go ahead and go back on your stomach here. We can do a fluid wave test. So what we would do is we would actually have the patient take her hand and put it like right there. Okay, good, and press down. And this is if she has ascites. So then we can go ahead and create a little bit of a wave, and the wave should continue over here to the other side through the fluid. So so that's the test for ascites. So that's basically our abdominal exam. So do you have any questions? No. Good deal. All right. Well, have a good day, students.